Although you have the option of reporting PQRS measures individually for each provider, practices with 10 or more providers will usually want to report as a group if possible. For PQRS purposes, a group is considered any tax ID number with 2 or more providers who bill to Medicare. You'll need to register your group with CMS and identify what reporting option you'll use by September of 2014. You can watch video number 8 for details on the registration process. In the rest of this video, we'll briefly describe each of the group reporting options and provide a link for more detail on each. The first option is to report from your electronic health record system. If your EHR is 2014 certified, you may be able to complete a single report of quality measures that can be used both for meaningful use attestation and for PQRS. For many, this will be the easiest option, but it depends on the capabilities of your EHR. Group reporting will make it even easier as you will report the quality measures for the group as a whole rather than for each individual provider. Video number 4 provides more information as well as a list of questions that you should ask your EHR vendor now. Option 2 is individual measures reported via a registry program. A registry is a software tool that allows you to upload or enter data manually through a web interface and submits it to CMS on your behalf. For registry reporting, you would prepare and submit the data after the end of the calendar year. You'll need to report on 3 measures for at least 50% of the Medicare patients eligible for that measure in order to avoid the penalty, and report 9 measures to receive a 0.5% bonus payment. Most registry programs charge between $300 and $500 per provider, but have discounts available for larger groups. Video number 6 will provide information about selecting and reporting individual measures, both for registry reporting and reporting. Group reporting is not available via claims in 2014. However, it is possible to report 3 measures via claims for each of your individual providers. To avoid the penalty, each provider would select 3 quality measures. The appropriate quality codes would need to be reported on the same claim as the qualifying service for at least 50% of the Medicare fee-for-service patients seen by that provider who qualified for the specific measure. If you choose to report quality measures for each of your providers individually, you also have the option of reporting via a measure group. A measure group is a group of 4 to 9 individual measures that apply to the same population of patients, for example, diabetics or patients with back pain. If one of these fits the patients seen by a provider, you can complete a chart review of 20 eligible patients who that provider saw during the calendar year and report on each of the measures in the measure group. You'll use a registry program, which will have the similar $300 to $500 fee, and they will send your results to CMS. This reporting option is discussed in depth in video number 5. There are also some additional options for large groups, those with more than 25 providers. Remember that the count of providers includes mid-levels and therapists, basically anybody who bills Medicare under your tax identification number. We won't be covering these options, but you can find additional details on the CMS website, www.cms.gov/PQRS. Look under the GPRO web interface and CMS Certified Survey Vendor options along the left-hand side of the screen. Finally, a few important words about the Value-Based Modifier program. This impacts groups with 10 and more providers this year and will likely impact every group by 2015. If you fail to successfully report on PQRS at the level required to avoid a PQRS penalty, you'll not only get the PQRS 2% penalty, but also another 2% VBM penalty. If you choose to report measures for individual providers instead of the group, then at least half of your providers must report sufficiently to avoid the penalty. This is where performance really starts to matter. CMS will take the quality measures that you report and compare them to the mean for other providers in your specialty. They'll also look at other quality and cost measures that they calculate from claims data. You'll end up in one of these boxes. The idea here is that practices in the red box will be penalized as shown, and that the funds from these penalties, along with the 2% for anyone who didn't report, will be redistributed to the practices that are in the green boxes. Importantly, for 2016, which is based on what you report this year, you won't have a downside as long as you avoid the PQRS penalty, unless you have more than 100 providers in your group. Now that you have an overview of the various PQRS reporting options, feel free to pick and choose from other videos to get more details on the areas that are most applicable to your practice. For those of you that would like additional assistance, we offer a standard consulting package that covers all Medicare Quality programs, including Meaningful Use, PQRS, and Value-Based modifiers. We'll provide detailed requirements and timelines specific for your unique situation, and recommend approaches and measures that are customized for your services and size. The standard consulting package includes a 1-hour presentation to your practice leadership and key staff. Additional consulting services can be designed around your needs, including the development of comprehensive implementation plans, customized workflows and data capture tools, or staff and provider training. Just give us a call to discuss your specific needs.